Welcome to the Gastro Girl podcast. We bring together patients, experts, and health advocates who are all here to help you optimize your health. Here's your host, Jacqueline Gaulin.
Hey everyone, welcome to this episode of the Gastro Girl podcast. This episode is brought to you by Sanofi Regeneron, and today we're so excited to have Dr. Evan Dellon back again. He is an EoE expert as well as a professor of medicine and adjunct professor of epidemiology at the University of North Carolina School of Medicine in Chapel Hill. He is also the director of the UNC Center for Esophageal Diseases and Swallowing and serves as the associate editor for clinical gastroenterology and hepatology. Welcome back, Dr. Dellon. So happy to see you again.
Yeah, thanks so much, Jackie. Great to be here again.
Well, it's so exciting because we're coming off of a couple months now of Digestive Disease Week, which is DDW 2024. And I was amazed to see the amount of abstracts and research focused on Eosinophilic Esophagitis, or EoE. This is incredible, and a lot of new evidence surrounding treatment options, which is huge news for patients. So I thought we'd focus this episode mostly on treatments and what's been happening and evolving and the latest science around some of the treatment options. And then if there's any time left, we could kind of talk about other abstracts that may be of interest to our listeners. Sound good?
Yeah, no, that sounds great. And it was an amazing meeting, I think, from EoE and eosinophilic GI diseases. The sessions were packed with researchers and clinicians learning, and same thing with the posters, just a huge amount of new data being presented. And it's wonderful to see, ongoing and increasing interest in this and increasing research.
So from your standpoint, what should patients know coming out of DDW? Like where were the abstracts focused? I know before we started our episode, you broke it down into some areas: topical steroids, diet elimination, Dupixent. Like what are some of the new scientific findings that came out of DDW this year?
Yeah, I think it's a really exciting time for patients and for the providers, honestly, as well, because there are so many treatments, and we're starting to see now reports with new classes of treatments and efficacy. And so it's really pretty exciting. So I would break it down into a few different areas. The first one is that there were some data presented on a new medicine class that looks like it could treat EoE. And I don't know if people have heard of this or not, but it's a medicine called etrasimod. And this is actually a medicine that has been approved for ulcerative colitis. And it completed a phase 2 study in EoE. And the way the medicine works, it's a member of a class called an S1P receptor modulator. It's a sphingosine 1 phosphate receptor. And what the medicine does is it actually keeps the white blood cells in the lymph nodes rather than allowing them to get into the blood and ultimately into the GI tract to cause inflammation and irritation. And it's a pill. It's a pill that people would take once a day. And the phase 2 study compared 2 different doses to placebo. The initial 24-week results were actually presented back at the American College of Gastro meeting last fall, and then 52-week data were presented at this meeting. And the bottom line is it shows that this class of medications can work in EoE. It showed that it improved biopsies, and for people who had those biopsy improvements, that was maintained from 24 to 52 weeks. It showed it improved the endoscopic appearance, and it also helped symptoms in a subset of the patients. And so this is a possibility, I think, potentially going forward if it's studied in a larger trial.
No, that's fantastic. And now, is this ready for prime time? Can patients get this medicine, or is it not? It's just not.
So it is on the market for ulcerative colitis right now, but this was a phase 2 study. So it would still have to go through the phase 3 approval trial for patients to get it. Now, if you happen to be somebody with ulcerative colitis and EoE at the same time, which can happen, you can talk to your provider about, well, could this medicine benefit both of those conditions? But it would be off-label for EoE right now.
Interesting. So it addresses inflammation. Is that correct? Mm-hmm. That's interesting. So what else was exciting that patients should know about?
Yeah, so there was a whole lot on the topical steroid front. As you know, in the U.S., we had budesonide oral suspension just approved in February of 2024. And so at the meeting, there were some data related to that medication, in particular showing an excellent safety profile for 12 weeks of use, which is how it's approved. And then interestingly, in Europe, there were data on a different kind of a budesonide syrup in children. And so this was a study, in Europe, they've had the budesonide dissolvable tablet available for quite a long time now. And so the same maker of that is looking to extend into kids, and the syrup was easier for kids. And so that showed very good biopsy and endoscopic kind of responses in the children. So I think that was pretty interesting to see. Back in the US, there were data presented on a new medication, and this is a fluticasone dissolvable tablet. Now, many people may know fluticasone as the medicine in Flovent. Those are the inhalers that many people would squirt into their mouth and swallow over time. And so for a number of years now, this dissolvable tablet has been under development. You basically put it on the tongue, it melts, and you swallow it to coat the esophagus. And an initial phase 2 study was published a couple of years ago, and the data were now the first results from an initial phase 3 study. And it was just a subset of data that were presented, but it showed patients compared to placebo for once daily dosing had complete symptom response at a much higher rate than placebo. And it also showed that this medicine seemed to resolve scar tissue findings like rings and strictures on the endoscopy. So that's promising. And, this medicine is finishing an additional phase 3 study. And so maybe we get results on that later this year or early next year. And if those look good, it is something that could go to the FDA for approval.
Well, I mean, this is, even though some of these things are not quite ready for patient use right now, I think the key takeaway for patients, and if you agree, is that there's so much evolving in this field that you're not alone and you're not going to be out there without any treatment. There are options, and I want to move on to our next. And there are options coming down the pipeline, but there are options now that have shown even more evidence, like with Dupilumab. Which is also on, we've seen recent approvals in children. But can you talk a little bit about, there's a whole bunch of science presented at this meeting around that drug.
Yeah, absolutely. So, to remind everybody, Dupilumab was approved in
Dupilumab.
2020. Oh, no, that's okay.
I can't pronounce it. That's why I can never be a doctor. I can't pronounce the drug name.
Yeah. So there was quite a lot of information presented. And just to remind the listeners that this is an injection medicine that's been approved for asthma and eczema and several other conditions for quite a while. It was approved for EoE in patients 12 and above about 2 years ago. And then just in January, it was approved for kids aged 1 to 11. And so on the pediatric side of things, there were some data, new data that were presented, including data showing improvements in the endoscopic appearance in the kids out to 52 weeks, improvements in quality of life, and also very interesting improvements in weight gain. And so if the kids are having trouble eating, they get on this medicine and they start to have improvements in their growth and weight, which is really pretty impressive. And through all of these, the medicine is quite well tolerated. The full data on that particular paper will be actually published quite soon, and so listeners will be able to go see that. And then on the adult side, there were also some additional data, again looking at longer term treatment out to a year from the original trial, showing endoscopic healing and actually improvement across all of the outcomes, regardless if patients had required their esophagus to be stretched or not. So I think, more information that shows that the medication is effective in pretty much all the populations that we've looked at. So again, I think, for the people where this medicine is the correct medicine for, and it's not for everybody. In general, it's not for people who are, right off the bat, newly diagnosed. Many times we think of this as a step up medication, where if you're not doing well on other treatments, you would start this medicine. But the data and the efficacy data are looking quite good for this.
No, thank you. And, if you were for parents that are listening with a child with EoE, what would be the key takeaway for them to know about this new data?
Yeah, I think that, the official approval is for kids 1 and older and weighing 15 kilos or more. And so, if you are a parent and have a kid with EoE in that age range, and they're not responding to treatments like PPI or the swallowed steroids, this is really a great medication for them. Or, by the same token, if they're having side effects with those medications. And so it is something to consider. Of course, as a parent, you'd probably have to administer the medication to the kids themselves. But it's quite well tolerated and it's got a good safety profile.
No, that's great. Now, just keeping along the lines as we talk about children, there was some interesting science revolving some of the diet elimination. And I think there was one in particular. It talked about, the milk, eliminating milk, just that one thing. Is that correct?
Yeah, no, I mean, I think there were data, people are, I think, continuing to be really interested in diet elimination. And, if that's the right treatment for a patient and their family, I think it's a great option. And I always talk to patients and families about, do you want to think about doing the diet elimination or do you want to think about medicine? And that's sort of my first break point in talking to people. And for people who are doing diet now, there are some interesting data that shows that you don't have to go to these super restrictive diets. Traditionally, we had always talked about the 6-food elimination diet with dairy, wheat, eggs, soy, nuts, and seafood eliminated. But in the last couple of years, there have been some trials that showed that diet is roughly equivalent to just eliminating dairy as a starting point. And so there were additional data looking, well, what happens when people eliminate dairy? And in fact, mast cells, which are other allergy cells in the esophagus, and there's more that's going on in the esophagus than just the eosinophil, the dietary elimination can decrease the other allergy cells too, like the mast cells. So just more evidence that kind of treatment can work.
And I think this is a great episode because we're giving our listeners some information that they can then go back to their healthcare providers and talk about, because there's options out there. There are options, which is, we didn't have this, 10 years ago.
Or 2 years ago.
2 years ago.
In
Yeah,
this country.
true. That's true. Yeah.
It's I think really remarkable. And, the fact that, yes, the PPIs are still off label, but now, they're easy to get and generally inexpensive. So you have that option. You've got an approved topical steroid, at least if you're 12 years and above. And now you've got, Dupilumab as an approved medication. And then, more than that, the pipeline is really expanding. And just for interest, there were 2 other abstracts presented that showed really some novel kind of treatments. One is still on the topical steroid vein, but if you could believe it, it's a medicine. It's like fluticasone, but it's a really long-acting medicine that would be injected into the esophagus during a regular endoscopy. And the thought there is that maybe that would be a every 6 months or once a year kind of treatment. Obviously, very early stage. They're still in the dosing kind of finding for that study. But, again, something promising. And then a whole other class of medicines was looked at, again, in a very early study. And these are the JAK inhibitors. And this kind of class of medicine is approved for conditions like Crohn's disease and inflammatory bowel disease, and also eczema. And they have a very strong rationale for working in EoE. But again, it's going to be tested going forward. So we don't have any information on that yet, but just as a little hint of some of the other things that are coming down the pipeline.
What's so fascinating is we have several abstracts that deal with the pathophysiology, such as looking at the inflammation and the inflammatory response. But one of your areas of expertise, Dr. Dellon, is epidemiology. Can you talk a little bit about some of the studies that delved into the epidemiology aspects of EoE?
Yeah, so I think there's really ongoing interest in the epidemiology. And, for your listeners, that's sort of the study of how many people have the condition, what are the trends over time and in the world, what are the risk factors for the conditions, and actually what are the outcomes. And there's were a couple interesting abstracts. There was a series looking at EoE in Japan and Asia, and EoE had been thought to be very rare there. But it turns out that with newer studies, it is increasing, just like it's increasing in the US and in Western Europe and Australia. And so they're seeing it more and more frequently there. Then in terms of outcomes, there was a study where, and this was in children, where they looked at children who did and did not have good responses to therapy. And in particular, this was with the swallowed topical steroids. And then those children were, looked to see what happened to them over many years, like 5 to 10 years. And the kids who had a good response and their biopsies or their endoscopy looked healed visually did very well without stricture development. Whereas if you couldn't get a kid under control, they had, an appreciable rate of developing scar tissue. And so it really gives, I think, some good, value for the rationale of treatment and how to prevent complications.
No, that's really interesting. Thank you for highlighting that. Are there any other abstracts that we should bring attention to? I know there was some, related to disparities in diagnosing EoE at the ER level. Can you talk a little bit about what we're seeing in that area?
Yeah, I think that one was pretty interesting. Many people with EoE come to the emergency room, especially adolescents and adults, if they have what's called a food impaction. So the food gets stuck and they can't get it up or down. And for reasons, that we don't understand is related to disparities. There are certain populations like racial minorities or ethnic minorities who are less likely to undergo biopsies when they come to the ER for a food impaction. And in that case, you can't make the diagnosis. And part of that may be because when we think of EoE, right, the typical picture is sort of a white male who's younger. And so women, people who aren't white, older people, there's data behind all of them maybe not being diagnosed initially and having diagnostic delay. Now, what was interesting, though, is on the flip side, there was a different abstract specifically looking at that issue of diagnostic delay. And often what we see is as you look overall across the lifespan, adults tend to have longer times, like 5 or 10 years or longer with symptoms before they get diagnosed, but even kids might have 2 or 3 years. And we wondered whether we might see the same disparities by race and ethnicity. And interestingly, we did not. And so, whether patients were white or black or Asian or Hispanic, in the youngest age kids, there really wasn't a disparity related to race and ethnicity, which was actually very reassuring. I think it shows that those kids are not lost. And whether it's regular insurance or if the healthcare kind of network, the parents are able to get them in, get them taken care of, and get them diagnosed.
No, that's very enlightening. I'm glad you brought that up. Is there anything else that you found interesting in our few minutes left? I know you're on a time crunch. You have patients to work with and lives to save. So we could talk about EoE all day, but in all fairness to your professional life, let's highlight anything else we may have missed. I mean, there were so many good ones, I thought, but I want to hear what you recommend us talking about.
I would maybe point out one other things that I would say maybe your listeners haven't heard about yet. And many patients, I think, always ask, how bad is my EoE? Is it, mild or moderate, or is it really a pretty severe case? And so a group of researchers got together a couple of years ago to develop something called the Index of Severity for EoE, abbreviated IC. And we can use different factors about the patient and their disease course, particularly how symptomatic they are, have they had complications of EoE, and what their endoscopy and biopsy looks like to rank, to give points and see if they're mild, moderate, and severe. And there were several abstracts now looking at this. And, the ultimate goal of this is to try to make treatment a little bit more consistent. And this is really common for asthma, right? If you have mild intermittent asthma, you know what to do. If you have persistent asthma, patients, providers can look it up and see what treatments are supposed to be on. And so that's where we're going with this, with EoE. But now it's just to the point where people are studying it. And so the question is, okay, what do patients who have mild, moderate, and EoE look like, and severe EoE look like? So, one of the abstracts looked at the people who are severe at diagnosis, maybe having less of a chance to respond to topical steroids and needing maybe more intensive treatment up front. There was another abstract looking at people who are in the more moderate range compared to mild, having a more stiff esophagus, measured during endoscopy with something called EndoFlip. And then there was one showing that even people with the more mild and severe aspects of EoE can still respond to a medicine like Dupilumab. And so this is a tool that we're hopeful will be used not only to sort of classify people, but to give some information about what may happen to people going forward and maybe what the best treatments and follow-up recommendations are.
Well, this has just been so interesting, and I appreciate your coming on today. Any final thoughts, any comments for our listeners? I know for me, I feel like this science gives hope out there for knowing that there are treatment options and that this is being studied and taken very seriously. So I think that's good news for patients. Anything that you'd like to add?
Yeah, I think that, for parents and patients out there, the researchers in EoE, we collaborate amongst ourselves. There are many different specialties that are collaborating, GI, allergy, epidemiology, pathology, dietitians, adult and pediatric providers, but we also collaborate with patients. And we try to take, your voice into consideration when we're doing research. And so you can be represented in different patient advocacy groups. You can see a website like EGID Partners, which is a patient-powered research network that you can check out. And so all of those things are ways to be involved in research. And it comes down to people participating in the trials. And I'm so thankful for my own patients who participate in these studies that now benefit literally thousands of patients who can get access to these medicines. So I think the goal is to continue this and expand the care options for all of you.
Well, thank you so much for caring so much about patients and for all the research that you and your team and your colleagues have done in this space. It's amazing how much progress you've made. Like you said, just in the last 2 years, it's been incredible. Thank you as always for coming on, and we look forward to having you on again. Thank you so much.
Yeah, thank you so much. It's great to be here.
Thank you for listening to the Gastro Girl podcast. For more information and resources, please visit gastrogirl.com. Do you have a question for Gastro Girl? Please email podcast@gastrogirl.com. The information, opinions, and recommendations presented in the Gastro Girl podcast are not a substitute for medical advice from your healthcare professional. Please consult a licensed clinician in your state regarding all matters related to your health.